And I reviewed your chart, and it looks like you have some pain on the inside of your ankle.
Yeah, it's right about here.
Oh, okay. Can you tell me what happened?
I was playing soccer and a girl slid into me, and it's just been hurting since.
So how long ago did that happen?
About 2 days ago.
And then on a scale of 0 to 10, 10 being the most excruciating pain and 0 being no pain at all, what would you rate your pain at?
About an 8.
When did you first notice the pain? And does it hurt more when you put pressure on it or when you're just sitting?
It hurts to walk on it, so I've been limping a lot, but other than that I don't really notice it much. I've been icing a lot.
Okay. So if you don't mind, we're going to go through a couple motions in your ankle and take a few measurements just to see what's going on with your foot.
Okay.
I'll just have you lay back and then put your foot over this way. So I'm going to compare how big your ankles are from one to the other. Okay. So this one's about 49 centimeters. Now can I compare your left? This one's about 45 centimeters, so you definitely have some swelling on your right side. And now we're going to test some of your range of motion. So we're going to start with your good foot first. We'll test this one. Oh, definitely. Does this hurt?
Not that much.
Now, how about when I do this?
A little.
Okay. You're definitely, just by looking at it, we can tell you're missing some of your range of motion. I'm just going to jot those numbers down. So we're going to also test your sensation in your feet. Can you close your eyes for me? And then just tell me where I'm touching.
Inside of my right foot. Bottom on the left foot. Outside of my right foot. Right where the injury is.
So we'll say your sensation is looking good. So now that we see that there's a little swelling in your right foot and your sensation is just fine, it looks like you have a sprain in your deltoid ligament, which is right about here. So before we get started, I'm going to take your pulse and your blood pressure. Is that okay? Yes. Everything looks good. I just have a few more questions for you before we get started. Is there a chance that you could be pregnant? No. Do you have any metal in this area from prior surgeries or anything? No. Okay. Do you have a history of cancers or any vascular problems? No. Okay. Since I know that it's safe to use and due to the swelling and pain, it seems like you have a ligament injury, I would like to perform an ultrasound on you. Have you ever had ultrasound before?
No.
Okay. Okay. Well, this is a type of ultrasound, not to be confused with the diagnostic ultrasound you would use for like pregnancy or something. It is a heating technique that can be used to transmit heat to deeper parts of your muscles and tissues, but we're not going to use it for heating today. The sound is filled with, this little sound head is filled with crystals that produce sound waves that vibrate your tissues and will move around the cell in order to decrease swelling and to reduce pain and promote elasticity in your muscles and stuff. And they'll make it more stretchy. And during the ultrasound, you may feel some warming sensation, but we're not trying to go for that today. And you might also feel a little bit of tingling around the area. Do you have any questions?
No.
Okay. We're going to go ahead and let you know that there is some precautions when taking this. Do you have a fracture in the area, or do you have any growth plates?
Not that I know of.
Okay. So neither of these will be an issue for you. There's a chance of irritation from this gel that we will be using. So there is a risk also from burning, but we're going to keep moving it so we don't burn you today. we're gonna do our best to perform everything to make sure nothing bad happens. Are you still okay with going ahead with the ultrasound?
Yes.
Okay. And then we already tested your sensation. And then you're in the proper position for our ultrasound today. I'm just gonna put this towel below you in case we get gel everywhere. And I'm gonna go ahead and set up the ultrasound. Okay. So in order to use the ultrasound, we have to turn it on in the back. Okay, maybe we'll just X-nay this part. So we're gonna go to ultrasound. And considering we think this is a superficial area, we're gonna do 3.3 hertz and a duty cycle of 20 because we don't want any of your heating effects. And an intensity of 0.7 since you haven't used it yet. And we're gonna do it for 9 minutes. Okay, and then we're gonna move the head in small circles of about 4 centimeters per second. Okay. Since we're gonna treat this area, we wanna make sure the ultrasound head is big enough. And you can only use it between, like, as big as 4. After that, we shouldn't use the ultrasound anymore. So, 1, 2, 3. Okay, so that should be good. I'm gonna put some of this gel on you. It could be cold, I'm just warning you. And then, so that's going to be a good medium between the two. And we already set up our ultrasound, so. So it's been about 5 minutes. How is it feeling?
Good.
Do you feel any heat?
No.
That's good. Okay, we're all done today. We're just gonna clean you up a little bit. So how did it feel?
Good.
Do you still have as much pain as you did at the beginning?
Not as much, probably about a 5.
Oh, very nice. And we'll just ultrasound gel all over the place. And then I'm also gonna test out your range of motion again. Just see if that helped it any. So, that doesn't hurt, does it?
No.
And then how about when I do this?
A little, not as bad though.
Oh, okay, that's very good. And then we're also gonna check out to make sure to see if it helped with swelling today. Oh, swelling went down. That's good news. And so from now on, I'm gonna see you about 3 times a week for the next 6 weeks to help you with your pain and swelling and help that ligament recover. And we're probably gonna do this ultrasound for a few more sessions to help with the pain and the range of motion.